Home to approximately 300,000 people, Riverside, California is a city with a diverse culture, a rich history, and one that fosters innovation. Unfortunately, Riverside is also one of California's most underserved communities. With an estimated shortage of a minimum of 5,000 physicians in the next decade, there is a dire need for primary health care in Riverside. To make matters worse, many in this city simply cannot afford to pay for health insurance. But a group of young individuals are looking to change that. Every other Wednesday, medical, graduate, and undergraduate students meet at the First Congregational Church in downtown Riverside to give primary health care and services to the public, free of charge. This is the Riverside Free Clinic.
So RFC is unique because we have medical students that are providing the direct care as well as running the clinic in general, in addition with our undergrads. These students make the clinic their own in every possible way. I'm really just there to support and to teach them, which makes it a lot more fun and engaging.
This is not just about the UCR medical students. Actually, it's the whole team that's working down there. One of the more exciting aspects is the heavy involvement of UCR undergraduates along with our medical students, because not only are they a lot of help, but they are also learning a lot about helping others, interacting with patients in a professional way that help guide them toward potentially careers in healthcare themselves.
This is a terrific learning experience for our students and for all of the students who participate. And in all honesty, I'll also say it's a terrific learning opportunity for the faculty members who participate as well. The number of areas in which I think our students come away from this experience educationally enriched are innumerable, but it's an opportunity for them to begin to develop clinical skills that they will use across their entire professional career. It allows them to understand some of the challenges in accessing and affording health care. It is really a unique interprofessional experience with pharmacists and dentists and nurses and medical students and mental health professionals all in the same setting, all working with the same population, all aiming for the same goal of adding their skills and their knowledge to an environment that provides comprehensive health care for the people who access services in our clinic.
RFC allows us to practice all the material that we learn in school through our hours of academic reading and everything, and applying it in a real life scenario, hands-on approach with real clients.
Over the years, RFC has not only changed its name and seen a number of new patients and students, but it has also seen a plethora of new services that were not previously available.
You walk into the clinic and you turn left, and it is a madhouse of people in there. There are multiple 30-something chairs on the left side of that hallway, and on the right side, it's all the services that our clinic offers, and it's really unique because it's all in one place. And so while they're waiting to be seen by the physician and student, they can ask about smoking cessation, they can ask about how to get resources for discounted utilities, mental health. All those programs are right across the way. And what's really cool is we also offer health insurance enrollment now. So we're looking into getting a certified health insurance trainer within our staff. So the second coolest thing is the expansion of the dental program. In 2010, we had one single chair with maybe 3 to 5 dental students, and they stood around and just did inspections, consultations. Now, if you walk into that room, it is a dental office with all the equipment, everything, x-rays, and I think it's pretty remarkable to see the growth that happened, within 5 years.
I've seen a lot of patients here, and a lot of them tell me their story. Some of them say they haven't been to a dentist ever, or it's been multiple years since they've seen any dentist. So you get to see a lot of different patients, and you get to basically get a little bit of everything, and that's what I like about it at the dental clinic here.
In addition to medical, dental, and mental health services, the Riverside Free Clinic also offers in-house pharmaceutical services free of charge.
So one of the things that's amazing about this clinic and our pharmacy is that we're able to give care to patients who won't have any other option. We give them free medications as well as consultations and care from our pharmacy. Our students from pharmacy schools, first through fourth year, are able to get experiences that they never would have had in their classrooms. And so really it gives back to not only the patients, but also the students that we have here.
The clinic really does help with the collaboration of students. It helps them to become more of a team, much more what you would see in the real world.
A unique perspective that I have at clinic and that honestly inspires me every single time we have clinic is the fact that everyone puts in so much passion and work into what they do. So seeing the undergrads, for example, being the legwork of clinic, they get there early and they set up and they take everything down. Every project that we have going on at clinic, the heart and soul of it might be an idea from somebody else, but it's really the undergrads that work every single day behind the scenes to make sure that it happens. There's a lot of work and effort that goes unseen, basically.
As undergraduate students, we've been privileged enough to work alongside medical students and even graduate students in providing services to our community, including diabetes management, stress relief, smoking cessation, and many other social services. Primarily, I am very thankful for such an exposure, such an experience, to give me an in-depth, detailed look at some of the leading causes affecting our health in our community.
The first 2 years of med school are very hard, and they're very focused on books and studying and tests, and you just have a lot to learn. You have to learn everything, in 2 years' time. But you can lose sight of why you're doing this. And with RFC, I haven't lost sight of why I'm doing this. Every 2 weeks, there's that reminder.
No activity that I've participated in here at UC Riverside embodies as much of the mission statement and allows students to act out the mission statement as much as Riverside Free Clinic.
Well, the mission of the RFC, I think, is critical. The care that we deliver is critical. The services that we provide are all provided on a volunteer basis, but that doesn't mean that the operation of the clinic itself comes with no cost. We provide dental care, we provide pharmacy services, we provide a variety of laboratory tests, and we have a lot of disposable equipment, and that's all covered by the budget of the Riverside Free Clinic, which allows us in turn to provide it to our patients at no cost to them. This clinic would not be as successful as it is were it not for the very generous support of people who have opened their pocketbooks over the year and provided the sort of financial support we need to keep our doors open every other week, year-round, for people who are at the highest need.
To learn more about the Riverside Free Clinic, or to see a schedule of our upcoming clinic dates, please visit us at www.riversidefreeclinic.com.